Hi everyone, welcome to researchmd.com. My name is Dr. Pramil. I work as a Chief Medical Officer and an Associate Professor of Medicine at one of the large medical schools. So let's look at some of the medical news. Very interesting report coming about a nurse, a 52-year-old nurse from Kentucky. She was sentenced to 5 years in jail. So let's look at the circumstances, like what happened in this nurse's case. Okay, and there was a 97-year-old patient fell down and came to the hospital. This nurse was taking care of the patient, and what happened was, like, as we see, like a lot of times, elderly patients come to the hospital, they get agitated, so it's very hard to control their behavior because they are in a place they're not very familiar. They can go into like delirium. It's very common. So this 52-year-old nurse was taking care of the patient, and once the patient got agitated, she asked for restraints, which is also very common. And she asked the next common thing is like call the doctor or the nurse practitioner requested, can this patient have some kind of sedative? But it was declined by the physician and the nurse practitioner. So what did she do? So the 52-year-old nurse got medication from another patient, and she gave one dose of lorazepam or Ativan, which is a Schedule 4 narcotic, to this patient. Okay, so someone asked later on, like, hey, what did you give to the patient? She said, I gave something special. So the patient calmed down. Later on, what happened was patient became hypoxic, decreased mentation, and patient started aspirating food and developed aspiration pneumonia, and the patient died 5 days later. This patient was also on a oxygen saturation monitor, which somebody turned it off, and I'm not sure who turned it off. So there was, from this nurse, when the patient went into respiratory distress, or she did not even call a rapid response. That is the main way to get everybody else on board and kind of look at what's going on to assess the situation and help the patient. Initially, when they asked, she said, no, I have not given the patient. She also tried to change the medical records on this patient, which absolutely no. If you make a mistake or anything in the medical record, you cannot take it out. Okay. So unfortunately, 5 days later, patient died of aspiration pneumonia, and this nurse was accused of killing this patient, and she was recently sentenced to 5 years in jail. I think she pleaded guilty. So the learning point, if you're a nurse or a physician or any kind of healthcare worker, just be careful when the patient when you give sedative to the patient in the hospital. Okay, if you have to give, start with the smallest dose you can, and then try to go up. Because everybody is watching. There's a lot of opioid-related deaths in the hospital, outside. And always when somebody gets agitated, you want to give a sedation, find out what exactly going on in this patient. Is there something else? So go and see the patient. I have seen some of the doctors try to order some drug over the phone. Not very good. Always assess the patient, finding what's going on. Is there any other way you can do? Maybe something else causing the problem. And use sedative at the last minute if you can. I'm not saying you don't need to use it. Okay. And then also, if you do something in the medical record, or if you document it, please don't go and correct it. Once everything goes into medical record, it stays in the medical record. So if you have any comments, please put this under comments on this under the video. Let's have a discussion. Thank you so much for watching. Please subscribe to our channel. Thank you.